You could have lung cancer. 10 symptoms of lung cancer. 1. Persistent cough. A persistent cough is defined as a cough that lasts for more than 3 weeks and is a common symptom that prompts individuals to seek medical attention. While it can be caused by various conditions such as respiratory infections, allergies, or postnasal drip, it can also be a warning sign of underlying health issues, including lung cancer. In the context of lung cancer, a persistent cough may manifest as a dry cough or one that produces blood-tinged sputum, known as hemoptysis. This occurs when cancerous cells or tumors irritate or obstruct the airways, leading to chronic irritation and inflammation. It's important to note that not all persistent coughs indicate lung cancer, but any cough that lasts longer than 3 weeks, especially when accompanied by other symptoms such as chest pain, shortness of breath, or unexplained weight loss, should be evaluated by a healthcare professional to rule out serious conditions linked to lung cancer while maintaining clarity and accessibility. 2. Shortness of breath. Shortness of breath, also known as dyspnea, is a condition characterized by difficulty in breathing or the sensation of not getting enough air. It can range from mild to severe and may occur suddenly or develop gradually over time. Shortness of breath can be caused by various factors such as physical exertion, anxiety or stress, respiratory infections, asthma, chronic obstructive pulmonary disease, heart conditions, and lung diseases including lung cancer. If you experience persistent shortness of breath or any concerning symptoms, consulting a healthcare provider is crucial for accurate diagnosis and management. 3. Chest pain. Chest pain is a symptom that can have various causes, ranging from benign to serious conditions. In the context of lung cancer, chest pain typically arises when the cancerous growths or tumors in the lungs irritate nearby tissues or press against nerves, ribs, or other structures in the chest cavity. The pain can manifest in different ways, such as a dull ache, sharp stabbing sensation, or a persistent discomfort in the chest area. It may worsen with deep breathing, coughing, or certain movements. It's important to note that chest pain alone does not automatically indicate lung cancer, as it can also be caused by conditions like muscle strain, acid reflux, or inflammation of the chest wall. If you experience chest pain or any concerning symptoms, seeking medical attention is important to ensure timely diagnosis and management. 4. Coughing up blood. Coughing up blood, medically known as hemoptysis, is a symptom that occurs when blood comes up from the respiratory tract and is expelled through coughing. This can be alarming and may indicate a serious underlying condition, such as lung cancer. In the context of lung cancer, coughing up blood occurs when cancerous tumors or lesions erode blood vessels within the lungs or airways. The blood may appear bright red, frothy, or mixed with mucus. While hemoptysis can be caused by other conditions like bronchitis, pneumonia, or tuberculosis, it should always be evaluated by a healthcare professional, especially if it persists or recurs. Immediate medical attention is crucial if you experience coughing up blood, as it can signify significant health issues that require prompt diagnosis and treatment. 5. Hoarseness. Hoarseness is a symptom characterized by a change in the voice quality, often resulting in a raspy, rough, or strained voice. It occurs when the vocal cords become inflamed, swollen, or disrupted in their normal vibration patterns. While hoarseness can be caused by temporary conditions such as acute laryngitis due to viral infections or overuse of the voice, it can also be a sign of underlying health issues, including lung cancer. In the context of lung cancer, hoarseness may occur when cancerous tumors or lesions affect the nerves or tissues near the vocal cords or within the chest area. As the cancer progresses, it can lead to compression or invasion of nearby structures, resulting in changes to the voice quality. It's important to note that hoarseness alone does not necessarily indicate lung cancer, as it can be caused by various benign conditions or lifestyle factors. However, persistent hoarseness lasting more than 2 weeks, especially when accompanied by other symptoms such as coughing up blood, difficulty swallowing, or unexplained weight loss, should prompt medical evaluation by a healthcare professional. 6. Unilateral shoulder pain. Unilateral shoulder pain refers to pain that occurs on one side of the shoulder. While it can be caused by various factors such as muscle strain, shoulder joint injuries, or degenerative conditions like arthritis, it can also rarely be associated with underlying health issues including lung cancer. In the context of lung cancer, unilateral shoulder pain may occur due to the spread of cancerous cells to the bones, including the shoulder blade or collarbone. This metastasis can weaken the bone structure, leading to pain and discomfort in the affected shoulder. It's important to note that unilateral shoulder pain alone is not specific to lung cancer and can have many other benign causes. Depend on the underlying cause identified through these evaluations. If you experience persistent or worsening unilateral shoulder pain or any concerning symptoms, it's important to seek medical attention for appropriate diagnosis and management. 7. Unilateral chest pain or back pain. Unilateral chest pain or back pain, localized to one side of the chest or back, can arise from a variety of causes, ranging from benign musculoskeletal issues to potentially serious underlying conditions such as lung cancer. In cases where lung cancer is involved, such pain may occur due to direct effects of tumors pressing on nearby structures like the chest wall, ribs, or spine. Additionally, metastasis of lung cancer to bones in the chest or back can weaken these structures, leading to localized pain. It's crucial to emphasize that unilateral chest or back pain alone does not definitively point to lung cancer, as it can stem from injuries, nerve compression, or other health issues. However, persistent or worsening pain, especially when accompanied by symptoms such as coughing up blood, shortness of breath, unexplained weight loss, or fatigue, warrants prompt medical evaluation. 8. Unilateral edema. Unilateral edema, characterized by swelling in one limb such as a leg or arm, can be indicative of various underlying conditions ranging from benign to potentially serious health issues like lung cancer. In cases where lung cancer is involved, unilateral edema may occur due to factors such as compression of blood vessels by tumors in the chest, which can impede normal circulation and lead to fluid accumulation in the affected limb. Additionally, metastasis of lung cancer to nearby lymph nodes or organs may cause lymphatic obstruction, further contributing to unilateral edema. It's important to recognize that unilateral edema alone does not definitively indicate lung cancer, as it can also be caused by conditions such as venous insufficiency, trauma, infection, or inflammatory disorders. 9. Difficulty swallowing. Difficulty swallowing, medically termed dysphagia, refers to the sensation of food or liquids encountering obstruction or difficulty passing through the throat or esophagus. While dysphagia can stem from various causes such as esophageal disorders, neurological conditions, or muscular impairments, it can also be linked to underlying health issues such as lung cancer. In cases of lung cancer, difficulty swallowing may arise due to several mechanisms. Cancerous growths in the lungs or mediastinum can exert pressure on nearby structures like the esophagus, causing narrowing or blockage that interferes with the smooth passage of food or liquids. Additionally, metastasis of lung cancer to surrounding organs or lymph nodes can also impact swallowing function. 10. Chronic respiratory infections. Chronic respiratory infections refer to recurrent or persistent infections of the respiratory tract, including the lungs, bronchi, and airways. These infections can manifest as chronic bronchitis, recurrent pneumonia, or other long-term respiratory illnesses. While chronic respiratory infections can be caused by factors such as smoking, chronic obstructive pulmonary disease, or weakened immune systems, they can also be indicative of underlying conditions like lung cancer. In the context of lung cancer, chronic respiratory infections may occur due to the obstruction or narrowing of airways by cancerous tumors, which can impede normal airflow and clearance of mucus. This obstruction creates a favorable environment for bacteria and other pathogens to thrive, leading to frequent or prolonged respiratory infections. Additionally, the immune system's ability to fight infections may be compromised in individuals with lung cancer, further contributing to the recurrence of respiratory infections. This concludes our video on 10 symptoms of lung cancer that you should never ignore. In summary, we mentioned persistent cough, shortness of breath, chest pain, coughing up blood, hoarseness, unilateral shoulder pain, unilateral chest or back pain, unilateral edema, difficulty swallowing, and chronic respiratory infections. Each of these symptoms can indicate serious health problems and should be evaluated by a healthcare professional if they persist or worsen. If you found this video useful, please like and subscribe for more health-related content. Don't forget to press the notification bell so you never miss an update. Thanks for watching and stay healthy.